I would like to introduce the one and the only Valarie Worthy. Valarie is a registered nurse. She is a patient navigation manager at Duke Cancer Institute. She is a 23-year breast cancer survivor. And she's going to be speaking on the numbers don't lie, the patient needs, and the patient expectations in clinical trials.
I'm excited to be here. This month I do celebrate 23 years of being a breast cancer survivor. Now I tell you, I've been a nurse for 40 years. Yes, I graduated when I was 5 years old, so don't count me. No, I'm just joking. But when I went in to see my doctor, I did not know anything about oncology, so I was as afraid as anyone that didn't have any medical background. I think being part of an advocacy organization, thank you so much, Ricky. Touch has been a dream for me, but being part of that has explained my why. Why was I diagnosed? Why am I a patient navigator now? And just being able to have those conversations really make a difference. So when we think about our expectations, what our patients expect, what did I expect when the doctor said, you have cancer? I didn't have any expectations. And so when I sit beside my patients, they have no expectations because they don't know. They don't know what to expect. Their expectation could be, I want to live. And so that's how this conversation begins.
Wow.
They want to live. So how do we help them?
Well, Valarie, let's talk about it. You know, we want this to be a dialogue between you and I, talking about what patients should expect, right? They go and they're scared, they're newly diagnosed, they may not understand anything about the biology of cancer. How do we prepare patients for that clinical appointment?
You know, I think about that often when I talk to patients and I do an assessment. But if you think about it, for those of you that have sat in front of your doctor and he said, you have cancer, did anybody first and foremost ask you, what's your learning preference? Do you like pictures? Do you like videos? What do you like? And then we are asked, after they explain that in whatever language that we don't understand, to sign an informed consent. So how do we sign a consent saying we understand everything, including the clinical trial, and you know how thick those pages are? How can we say that now we have patients that are informed that sign a consent?
Well, let me ask you this, Valarie. When I tell a patient they've got breast cancer, it's like a bomb went off and they can't hear anything else after that, right?
Absolutely.
It's like those war movies and you see people's mouths moving, but you don't hear anything.
Nothing.
When is the right time and how do we truly inform a patient about that consent process?
I think that we have to explain it to the patient in a way that they understand it. I love our surgeons. Dr. Lola, I've sat with her and at Duke, when she was at Duke, please come back. But I sat with her and they actually draw pictures so that patients understand what's going on with them. And then it's a talk back. What did you hear me say? And oftentimes we don't do that. We don't ask patients, what did we say about the clinical trial? What did we say about the support that you're getting? Did we ask you about transportation needs? None of those things did we ask.
Wow, so you're saying a patient should expect better communication.
Better communication.
Okay.
And then the doctor or nurse or whomever should confirm that they understand what they were told.
And what do patients understand about clinical trials? You go in and, you know, patients, when I start talking the word trial, they start leaning back and the body language changes.
It changes drastically. So what patients understand is that this is an experiment and it may not help me. And another biggie that we don't even think about. So when we're talking about clinical trials to our patients, we are talking not only to that patient, but we're talking to the family member, we're talking to the community, and we're talking to the church. And if you don't give them language that they can convey this back to that community, you're gonna get a phone call saying, I changed my mind, I can't be a part of that clinical trial. So we have to change the verbiage, change the narrative, and speak to people in a way that they then can represent the thing that they want to do. Even if they want a clinical trial, somebody's going to talk them out of it because that person doesn't know. But what if we educated the community? What if after the pastor prays for that person, then they say, you're going to go to your doctor, and your doctor is going to say, this is our plan for you. And what if the pastor says, make sure someone says something about a clinical trial? What if we did that? Would we not change the landscape? I think we could do that.
Do patients have a positive understanding or a positive appreciation even of clinical trials?
No, they don't. And I think the onus is on those of us that are cancer survivors and cancer survivors who have gone through a clinical trial. It is still a stigma, at least in my community in North Carolina, it is still a stigma to have cancer. So nobody's talking about it. Nobody knows that God is a healer with clinical trials and your treatment.
Ooh.
Yeah.
Talk to me about patient education. What else do patients need to understand?
Patients need to understand that there are people there that love you, that's going to take care of you, and you just keep looking. If you don't find it that place, go to another place. But do not give up. They are people like me that care about you.
Wow.
And I think we have to close now.
Thank you so much. We're gonna